Hi again, my name's Ray Peachey. I'm the Substance Abuse Prevention Coordinator for the town of Westford, and I am the host of Healthbeat. Today I've brought a friend of mine, Maria Ruggiero, and Maria is the Program Director for the Substance Abuse Prevention Collaborative, which is a group of towns around us that work together, funded by the state, and we help set up programs, we get grants, and we try and help each other out with substance abuse. The towns would include Billerica and Chelmsford, Dracut, Lowell, Tewksbury, Tingsboro, Westford, and Wilmington. And there's a few of these around. How many around? Do you know how many throughout the state?
How many of the programs I have?
Yeah.
I'm going to guess there's about 30 of us, but
Okay.
that's an educated guess, though.
Yeah. And why don't you tell us a little about the collaborative before
Okay.
we go on?
Well, we concentrate on underage drinking and other drug use within our youth. People have said to me in the past, I know we're going to talk about opiates in a little bit.
Yes.
With this such an epidemic, why would we be talking about underage drinking? And, I always say we have a whole group that we're going to talk about in a second that really we're losing their lives. We're losing a generation. But what about the kids that are so young now that are just coming up? So we want to try to do is provide them education, coping skills, so that they don't wind up being down the same path. So we concentrate on underage drinking. We're trying to get education into the schools, as you well know.
Yes.
And we're just trying to take a overall approach to the problems that we're having here.
Yes, and that was part of the Botvin Life Skills program that we've been able to help the school implement into our school system in Westford. And that's going to be from 3 to 12th grade.
Yeah.
So that's a good program. We'll talk about that later on another segment maybe.
Yeah, and just to let you know, I mean, your school department is far ahead of some of the other communities within our collaborative. They're already in the implementation stage, which is wonderful.
Yes.
Yeah. And just, maybe if I just one sentence, the program that you talk about, we really don't talk about drugs. We don't tell kids drugs are bad, you shouldn't do drugs, because if you tell somebody don't, they're going to do it.
Right.
Kids tell us, just give us the information and let us make our own decision.
Right.
But what about the little guys? How do they cope? So it's really a program that teaches them how to cope with different things at a very young age, so that hopefully by the time they get up to the age where their friends or someone else is experimenting, they have other skills that they say, I don't need to do that yet. I can hold off.
That is a big part of it, the idea of being able to say, no, I don't want to, and make that decision. Not, again, the parents saying, no, you can't do that. And as we know, that sort of doesn't work. Some kids it does, but a lot of kids, experimentation, nothing will happen to me. That's their biggest problem, right now.
Nobody ever thinks it's going to happen to them.
No, correct.
Because if they thought it was going to happen to them, would they still do it? Maybe not. I don't know.
Exactly. Exactly. So with that, we're going to have two sections of this talk. One's going to be on the opiate problem, and the second one's going to be on the vaping problem, which is a big problem in not only Westford, but everywhere else. So we'll start with the opiates.
Sure.
Okay? What I have here, and you'll see it on the screen, is a map of the towns in Middlesex County. This is put out by the Middlesex District Attorney's Office of Marion Ryan, and once a month, Maria and I, along with probably, what are you thinking, maybe 30 other people are in there?
At a minimum. Sometimes it's standing room only.
Yes, and we get together, and she brings in a couple of speakers, and we try and talk about the opiate problems, the problems around town, around the area, and she passes out some good information. So as you can see, looking at this is effective up to date as of July 10th of 2018. It's indicating between 2017 and 2018, Westford has had 3 deaths. Now, I believe since July that Westford has had 1 more. It's not something that is really out there for us to know about. And these are deaths that the district attorney has investigated, and they investigate all deaths. So this is very good to look at. I like to keep these every month and keep going and know what's going on. One of the things that I'm going to do a little more local than Maria. Maria's going to do a little more of in the area, and I use her a lot. She has been a tremendous help to me. She works out of the Tewksbury Police Department under a grant, and a couple more years, 3 more years.
Yeah, three more years. Wow.
Yeah, and then hopefully we up it. This here is from the Westford Youth Risk Behavioral Survey that Westford High School gives out every 2 years. Once in a while I'll be talking about, we call it the YRBS. And again, I'll be talking about this, and again, I believe they're going to do it this year, right? 216, 218, I think it's this year.
I do too.
Okay, and it gets information from us. What I like about it talks about Westford. It doesn't talk about, well, the opiate problem in the United States. At this point, I'm focusing on Westford. I'm focusing on the area around Westford because it does help give me an idea of what's going on with everybody. But this particular one, ever used any prescription medication not prescribed specifically for you? When we get into high school, it starts out 9th grade, 4%, 8% for the 10th, 10 for the 11th, and 10% again for the 12th grade. And we are doing better than the aggregate, which is towns that basically use Emerson Hospital because they funded this survey. Lincoln, Littleton, Concord, Carlisle, Maynard, Westford, and there might be a few more in there, but it gives us a rough idea. But this is something that I can't wait to get the new updates and see how we're doing, and it goes by years and grades as well. Also, we have ever used any prescription opiate medication not prescribed specifically for you. And this is down from medication. Basically, it's medication with opioids in it or just plain medication. Let's look at the 12th grade. Westford said 10% without the opioids. The one with the opioids in it would be 7%. I mean, it's still 7% of the kids that took this survey is still way too many. I mean, we're finding, if I remember correctly, the deaths are going down, but the overdoses are going up.
Correct.
Is that correct?
That sounds correct, yes.
Yes, and part of that would be
Based on the Narcan.
the Narcan. You want to talk a little bit maybe
Sure.
about Narcan?
So Narcan really is, as far as, if you talk to some first responders, they'll tell you this is a miracle drug.
Oh, yeah.
What makes the opiates so dangerous is because we do have, a very simple way to explain it, we have natural opiate receptors in our brain. So when we hurt ourselves, our brain sends a opiate-like chemical to that spot. When you abuse it, just for a really easy way to explain it, if this is the receptor in our brain, Ray, we pour water in it or fluid into it. When that starts to overflow, that's when someone starts to overdose. So they start to breathe slower, minute by minute.
Yep.
What the Narcan does is basically it comes in, it kind of tips off the opiate that comes out of the cup, and then it puts a cap on it. So what's concerning about not calling a 911 is the fact that the drugs, the opiates, whether it be heroin or prescription drugs, they last anywhere from 2 hours to 48 hours, where Narcan, it lasts probably about 30 to 90 minutes. And basically what it is, it's very simple. You take it out of the case, you just push this, put it in the nostrils, spray. It's 4 milligrams. You want to make sure that the person is, that you're doing rescue breaths, and we can go through that in a second. Do you want me to go through that now? Or?
No, yeah,
Okay.
let's.
Okay. So rescue breaths, it's not really CPR. Rescue breaths, you want to tip the person's head back, and you want to breathe for them. Because basically what an overdose is, as you know, is it's taking the oxygen That's why people, when they're overdosed, they're going to have blue fingers. They're going to have blue
Correct.
lips, and that's because the body. It's amazing. Our body's amazing. It's trying to save itself, so it's pulling the oxygen away from everywhere that's far. That's the furthest from it. So what the Narcan does is it actually helps them. Brings them out of the overdose, but the drugs are still in the system. So you have to call 911.
You do.
If you don't call 911, then that person is just going to go right back into an overdose. Narcan cannot hurt you or I.
Correct.
A lot of times first responders will come, and if they have somebody down, they'll use Narcan first. If they respond, then it was an opiate. If they don't, then they go down their triage list.
Correct.
It takes maybe 2-3 minutes to work, and it literally can bring somebody right out of the overdose. I've had firefighters tell me this person was literally gone, and I gave them the Narcan, and they sat up and they started talking to me.
Yeah.
It's available. You can get it at pharmacies. I think in your areas, what is it, Walgreens and CVS? Is that what I remember?
And, well, right now, Rite Aid.
Right.
It's still
Yeah,
there.
yeah.
But, those three, you can purchase it. They will give you a short demonstration on how to use it, but it isn't very hard at all to use.
It's improved over the years. It
Yes.
used to be something we had to put
Yeah.
together, and it was,
Yeah.
it's nerve-wracking. Now it's literally one piece. When you take it out, you just spray it like that, and it
Yep.
immediately goes. It's amazing.
Yes. And this here is 4 milligrams,
Yep.
where the old ones were 2 milligrams, and and they're dated as when not to use them. But these are so easy. And just to emphasize, Maria and I could spray each other right now, and it would not affect us at all. So don't hesitate. If you have the slightest indication, try it. I mean, I would love to see everybody have this. And again, you can pick those up in the pharmacies. I want a couple of things I want to talk about. This year we've had 5 overdoses in Westford. 4 were from heroin, 1 was from pills. We've had no deaths so far. I believe, like I said, I believe there's 1 more. That's a possibility. It hasn't been confirmed. It has to be confirmed from the medical examiner to get onto the charts. In 2017, we had 14 overdoses and 6 deaths. And in 2016, we had 19 overdoses, 19 with 3 deaths. So we're starting to go down. We're starting to see, and that is the trend we're having in Middlesex County as well. And we just need to get this going. This opiate thing is just, it really
I mean,
is
we're
very
losing an
dangerous.
entire generation.
Oh,
We really are.
It's unbelievable. And another thing I would like to mention on this, and it's just a little bit with cocaine, is we're finding cocaine now having fentanyl, being laced with fentanyl. So these people snorting cocaine, thinking it's cocaine, and they're actually getting fentanyl into it.
And it's not the fentanyl that we're used to. Like, I know when I took care of my father, he had a fentanyl patch.
Yeah.
That's a pharmaceutical fentanyl. This is fentanyl that's being made in basements. That's being made in bathtubs by people. And it mimics it, and it's deadly.
Yes.
We've had kids wake up in the emergency room and want to know what happened to them. And of course they're told, well, you've overdosed. Or how could I overdose? I smoked a joint, or I did cocaine. I didn't do opiates.
And the joint,
but
just
it's
think
in there, yeah.
Exactly. Just to add again, they're lacing the marijuana now with fentanyl as well.
Yep.
And the victims do not know most of the time. The vast majority of times, they're not sure that, or they don't know that fentanyl is in there. So just something to please definitely keep in mind.
Because we'll have people say to us, I just did cocaine, and there's plenty wrong with that statement, but that's for
Yes, I
another
know.
show
Correct.
probably.
Correct.
But they'll say, I did cocaine. I know enough not to do an opiate. I know enough. I've been educated. And then here they come, they're overdosing on the fentanyl. And a statistic I'd like to throw out, although not every single person who has misused prescription medication has gone to heroin, but 4 out of 5 people who have used heroin have started with prescription medication. So that's another point we want to kind of keep in our minds, is something that is very helpful if needed,
Yes.
can really be addicting.
And another thing, a lot of the people that are getting addicted to the opiates aren't necessarily initially started as a person that wants to get on drugs.
Oh, absolutely, yeah.
I mean, you can talk about that in the sense
Yeah.
of sports injuries, maybe,
Yeah.
you know?
I know in my community in Tewksbury, we have a coach who, if somebody gets hurt, he will tell the parents, look, he broke his foot or it's a sprain. Don't let the doctors give you opiates, because we can educate and advocate for ourselves.
Correct.
There are times when somebody gets hurt and they need an opiate. Let's face it, it's a
Yes.
pain medicine. But you really want to be careful, especially at that young age. Another thing, too, that parents will say is the wisdom teeth. The kids would
Yeah.
get their wisdom teeth out, and the parents will say, well, geez, they needed a lot more than I did, but so I thought his or her pain tolerance was down. No, the pain, the pain is gone, but the addiction is starting in the brain. And basically what happens when it's somebody that young is the brain says, oh, again, simple way to explain it, oh, I'm developing, and so I have this chemical all the time. I must need this chemical to survive.
Yeah.
And that's what why is it together to say, hey, we need this opiate. Then you run out of prescription pills, or the doctors say, oh, not going to give you any more. And then they go to heroin, which can be cheaper than a 6-pack of beer,
Yeah.
and easier to
And
get.
cheaper than marijuana.
And
right
easier
now.
to get.
And easier to get. It is, it's quite something, and it can be purchased anywhere at all.
Mm-hmm.
It doesn't matter if you're in a city, or if you're in a country, or if you're in the richest town in the state. It's there. It's there for the taking and there for the money.
Has no boundaries, and that's,
No.
I think, when all the work we do together, the problems don't have boundaries, the drugs don't have boundaries. So why should us and the solutions have boundaries? So I think that's what makes us so strong in how we work together with that, on that. And the one thing I want to just really say about the opiate epidemic is people do recover. They can recover and lead very happy and productive lives. If people are just patient with people who are addicted and just understand it's a disease, and there are certain steps that need to be taken to have this person live a healthier life, but they're very sick. And let me tell you something, by the time they get to that point, I have never had one person reaching out for help telling me, I'm having the time of my life, I'm having so much fun,
Yeah.
but heck, I think I'll stop it anyway.
Yeah, exactly. No question about that. And I had a thought, and it just left me.
See that? I talk too much, I'm
No,
sorry.
No, you don't. Definitely do not. We actually do, and Maria has one, and Westford Against Substance Abuse also has one, a bedroom.
Oh, yeah.
And if you ever see one of our talks, or any talk that has the bedroom scenario,
It's called Hidden in Plain Sight.
hidden in plain sight. And it basically shows a bedroom sort of set up, and different ways that these drugs can be hidden. And you will be amazed. I mean, I think I've talked about it before, but it is definitely worth it. And if you see some of these talks, please come out to it. You know, unfortunately, it is not my child. And after, again, I think most of you know that I was a police officer for 25 years, and I dealt with the kids in the schools and the drugs, and the parents seem to be the last to know. Don't know why, but they do seem to be the last to know. So please, don't say it's not my kid doesn't do that. Just be a little more aware of what's going on.
And talk to your kids. I mean, they do listen. They might not tell you at that moment that they're listening, but they hear you.
Yeah.
I'd be straightforward. You know, when we did the assessment part of the grant that I did, and basically that is just going out and talking to people and
Yes.
finding out what the communities want. The kids told us that they know that this is dangerous for them, and they don't want to be told not to do it, but they want to know why. Once they have an understanding of what it does to them, then hope that gives them a little, some of them anyway.
Yes, yes.
The willpower to say, hey, I'm going to wait. And now the message is no longer, don't do that. The message is, can you just hold off until you're a little older? There's a reason why the drinking age is 21. There's a reason why that you want to hold off until your brain is developed.
Correct.
So I started on the bedroom, and I think I got ourselves off. Sorry about that.
That's all right. So with the rest of the time, I think we're going to maybe talk about vaping, which is a definite problem in Westford and a definite problem all over the state. This Department of Public Health has really gotten into trying to get rid of the myths with vaping. The kids will tell the parents, it's just a vapor. Just a vapor, there's nothing in it. It can't hurt you, there's no drugs. And I will tell you that probably 5% or whatever, there's actually nicotine minimum in there. You get hooked to the nicotine, then where do you go from there?
And the CDC actually states that when people say, is vaping safe? Well, first of all, we don't know if vaping's safe. We don't know. We can tell you the facts we have now. But by the time it's researched, 8 or 9 or 10 years down the road, we'll find our facts. But what it is, it's the new look of addiction. Not letting a child vape is it kind of sets up that pathway that,
no question.
People say it's a gateway drug. Well, what is a gateway drug? Whether you believe in a gateway drug or not, the vaping or the nicotine sets up that pathway. So it's a lot easier for a teen to say, oh, you know what, I'll try a beer, or I'll try a joint, or yeah, give me one of those pain pills. And they're look at the difference here. This is a pen, and this is a vaping pen. So they write in a toolbox, for goodness sakes, or a pencil box, you wouldn't even know the difference.
Yep.
And they're extreme. Look how small they get. This looks like a flash drive. Little flash drive, but it's not a flash drive. It goes into the computer, and then it charges the vapor. That's a vaping pen. They're so small, you can put them in the palm of your hand, you don't even see them.
Oh, yeah.
What's I think scares me the most, and a lot of people I talk to, is the drug that, or not the drug, I apologize, the chemical that is used to de-ice planes is one of the chemicals that is in the vaping pens.
Yeah.
The FDA says that those chemicals at a very small amount is safe in food, but it's not been studied or researched yet as to what it does when you inhale it.
And they are they are working on that right now.
Yep.
Again, back to the YRBS of 2016, and I will tell you that there's been a big increase since 2016. But it shows that in the 8th grade, 3% of the kids said they have vaped in the past month. 9th grade was a 3%. Then we jump up to the 10th in the high school was 9%.
Wow.
Grade 11 was 14%, and grade 12 was 18%. Now these are the figures that, again, the kids are telling us what's going on.
And nationally, and this was in 2015, 7.7% of the people smoked, of the Massachusetts high school students. This is all of Mass, by the way. Only 7.7% smoked. That's pretty good based on what we've been seeing 10 years in the past. Any tobacco product, which includes chew and everything, was 15.9%. Now here's the alarming. E-cigarettes, 23.7%. And the CDC says that e-cigarettes are not safe for people that are pregnant, young people, and adults who do not smoke. It might have less nicotine that's put in a cigarette, and so it could help an adult quit smoking. But if you've never smoked, and here you are vaping, it's not just water. It's a vape that has to be heated up to melt, and then what happens to it when it gets into our system?
And that's what they're trying to study right now.
Yeah, it creates something we know is called popcorn lung. And basically that just, our lungs, it restricts it so much that it's hard to breathe.
What I'd like to do is, because I know we're running down, just give you, I talked to both the Westford Academy and the Shobit Tech High School. And Westford Academy, if you're caught vaping, You have a 1-week suspension and a non-criminal $100 let me redo that. A Board of Health regulation fine of $100, which the administration of the high school and the school resource officer can enter. Neshoba Tech is a 2-day suspension and a $100 fine as well. Now, if you want to fight that, you'd have to go to court, and you pay actually for the court fee. There's a court fee for that. Now, Westford, the Board of Health, as of October 1st, you cannot have on your person a vaping pipe.
Oh.
Okay, so
Wow.
that's something that we got in there, because what is happening is it was very difficult. You know, you go into like the boys' room and there's 4 kids there, and you don't see the smoke because the vape just dissipates. All right, but you know that it's there. No, I wasn't vaping. No, I wasn't vaping. Well, now holding the pipe or having it on in your pocket, it doesn't matter. It will be a $100 fine and a suspension by the school. So that's where it is. It's no way to start. I mean, you do this, and then where do you go from a pipe to possibly a cigarette? Again, it's a habit that muscle memory. You know, I mean, good possibility. We need to stop this and stop it at the beginning in the middle school, and they are taught this definitely. So, anything else that you can that you want to add to the show?
The only thing I would add is or things that I want to say again, if I could say it again, is the fact that people who are in the throes of addiction, first of all, it's a family disease, so everybody within that family is suffering. They just need some compassion, some understanding, and some resources, some help. You know, when they say, I want to stop, they mean it, but then their brain might kick in, and then addiction kicks in, and it's to the point that they feel as though they're going to die. That's what I've been told.
And it's almost that I feel that they have to want to stop before they even try to go into a facility. They have to want to do it themselves.
You have to want to do it. And the other thing is just to educate yourself. I will hopefully never have the words come out of my mouth, it's not going to be my kid, because we don't know. Okay. We don't know who it is. So if everyone educated themselves, became advocates for even just hold it off until they're older, 21, 22, 20, just hold off. I think we'd have a better chance of having a healthier population as far as substance abuse is concerned.
Sorry, what I want to do is this thing right here, you know, these go into the what Maria has. They can be purchased with marijuana in them, not legally, but right now, you know, you can get them online with marijuana into it. So
and very
ahead,
easily,
yes.
I just touched this, and you're not going to be able to see it on the screen, but I have a little bit of nicotine on my finger right here. That can come out, and they take a little syringe, and they can put the marijuana oil, or I forget what it's called, and they could put the oil, CBD, and it's not just the THC oil too,
yes.
and put it in there, put it right back on. Not only can you not see it, when they take a drag, you can't even smell it.
Yeah, correct. And one last thing, the Westford Health Department has hired a drug counselor. That was from a grant from the Greater Lowell Community Foundation, and it will be over in February, but we are seeking more funds to keep her on. If you need any drug counseling, you can call me at the Westford Health Department, and I can set that up with for Meredith to give you a call.
And you're working with Tingsboro too on that, right?
Yeah. Yep, on that grant as well. Yep.
That's good.
Okay. Thank you for coming.
Yeah,
Appreciate it.
Pleasure to be here. Thanks for having me, Ray. It's always a pleasure to see you.
Same here. Same here. Thank you, everybody.